Let's take a look at the different Medicare Supplement Plan options you have. There are a total of 10 to choose from, and this video will cover the 5 most popular. Now before we get started, it is important to know that all Medicare plans are standardized. So a Plan A from one company has the exact same coverage as a Plan A from another company. And it is also important to know that different insurance companies can charge different premiums for the exact same policy. Here are all 10 options. It may seem a little confusing at first, but it is not as hard to understand as some agents make it out to be. All you need to do is look at the benefits at the left and see what each plan does or does not offer. So you can see that Plan F covers everything, and Plan G covers everything except the Part B deductible. And you can go through all the other letter options and see what they cover. So, the 5 most popular plans are Plan F and High Deductible F at 56%, Plan C at 10%, Plan N at 7%, and Plan G at 6%. There are special cases where looking at other options is appropriate, but these 5 plans will be what the majority of people will go with. It is also important to point out that 2 of the most popular Medicare supplement plans, F and C, will no longer be available after January of 2020. So it's probably a good idea to know what other options are available in the Medicare supplement market. And make sure to check out my other video on this topic titled Changes to Plans C and F. So let's start with the most popular plan, Plan F. Why is it so popular, you ask? Probably because it covers 100% of the gaps in Medicare. So, if you have a Medicare approved claim, your Plan F will pay everything left over that original Medicare Parts A and B do not cover. So, it will pay all your extra copays and deductibles that Medicare does not cover. Some other things Medicare and Medicare supplements that do not cover are dental, eye care, cosmetic surgery, acupuncture, and hearing aids. You can also add long-term care on there. So as long as you do not go to some kind of witch doctor for your care or need any of those services, your Plan F will cover 100% of the cost. Now, because Plan F covers the most, it is usually the most expensive per month. As you can see, a 65-year-old female from Hebron, Illinois will pay $134.59 to be on the Plan F. We'll use this premium to show the value in some other plans later. Now, High Deductible F covers 100% of what Medicare does not cover, but you need to meet a $2,180 deductible first. That is the only difference. So, you must pay for Medicare covered costs up to the deductible amount of $2,180 before your policy pays anything. As you can see, High Deductible F is much cheaper than Plan F, with it being $102 less. This is a good option for people on a very limited budget that are also very healthy. You definitely do not want to sign up for this plan at 65 if you already have health issues, because you will meet your max deductible fairly quickly. The next option is Plan C. Now, this plan is exactly the same as Plan F and covers 100% of the gaps in Medicare, with one difference. It does not pay for Part B excess charges. Now, Part B excess charges are when a doctor does not take Medicare assignment. So, some doctors can charge you 15% more than what Medicare is willing to pay for a test visit or procedure. Let's give you an example. Let's say you have a surgery with a doctor that does not accept assignment. According to Medicare, this service is supposed to cost $1,000. Well, Medicare will pay $800 of the bill, and your supplement will cover the other $200. But this doctor is able to charge 15% more because he does not accept assignment. So he bills you the $150 more, and with your Plan C, you will have to pay that $150 bill. Now, you can avoid this by just asking your doctor if they take Medicare assignment, and you will find out that most doctors take assignment and it only happens in rare cases. Now let's look at the premium. It's $146.42, and that's $12 more a month than Plan F. So you get less benefits for more cost. So this would not be a good recommendation for a 65-year-old female from Hebron, Illinois. Next up is Plan G, And much like Plan C, it covers everything that Medicare Plan F covers except for one thing. But instead of not covering Part B excess charges like Plan C, Plan G does not cover your Medicare Part B deductible. So you pay the first $166 of Medicare approved amounts that fall under Part B of Medicare. Now with Part F, the insurance company pays this $166 bill for you, but they charge you to make that payment. You can see how much this payment is by doing some simple math. So if a Plan F costs $134.59 and a Plan G costs $104.59, then the difference per year is $360. Now subtract the $166. So basically you are paying an insurance company $194 a year to write a check for you. So with Plan F leaving the market in 2020, along with the savings that you get writing your own check for your Part B deductible, I can see Plan G becoming much more popular in the years to come. Now Plan N covers everything Plan F does except for three things. It does not cover your Part B excess charges, much like Plan C, and it also does not cover your Part B deductible of $166, just like Plan G. Now what's the third thing? Well, there is a $20 copay for office visits and a $50 copay for emergency room visits that do not result in inpatient admission. So there are some copays, the one deductible of $166, and excess charges. But this can be a good option for people that want a reasonable premium, that are in good health, and that do not mind paying copays once in a while. The total premium for our 65-year-old from Hebron, Illinois would be $88.89 a month. So now that you know some of the most popular plans, how they work, and what the cost differences are between them, you can make an educated decision. It is important that you know that premiums for each of these policies change based on age, zip code, and sex. So it is a little different for everyone, but you will find that most of the time these plans will follow this same pattern. So how about we eliminate Plan C because you're getting less benefits for more costs? We can also eliminate Plan F because it will no longer be available in 2020. And is it really worth it to pay hundreds of dollars for a company to pay your $166 Part B deductible for you? Probably not. And now we are left with Plans High Deductible F, Plan N, and Plan G. I can see these being good options in different situations, but it really depends on the needs of the customer. And as always, remember, if you have any questions, make sure to call me at 920-960-4312 or shoot me an email at medicarescreenshare@gmail.com. Thanks again and have a wonderful day.